Anti-seizure drugs, anti-epileptic drugs. Mechanisms of action explained. Have you ever wondered how anti-seizure medications actually stop seizures inside the brain? In epilepsy, the balance between excitation and inhibition becomes disrupted. Too much excitation, mainly from glutamate, or too little inhibition, mainly from GABA, can trigger abnormal electrical activity. This diagram shows how major anti-seizure drugs work at the synapse to restore that balance. Overview of the synapse. Let's break this image down step by step. At the top, we have the presynaptic neuron, which releases neurotransmitters. In the center is the synaptic cleft, where neurotransmitters travel. And at the bottom is the postsynaptic neuron, which receives the signal. Two major neurotransmitter systems are shown here: glutamate, the main excitatory neurotransmitter; GABA, the main inhibitory neurotransmitter. Most anti-seizure drugs work by either 1. Reducing excitation, 2. Enhancing inhibition, 3. or both. Part 1. Sodium channel blockers. These drugs block voltage-gated sodium channels, shown here on the presynaptic membrane. Normally, sodium influx helps neurons fire rapidly and repeatedly during seizures. By blocking these channels, these medications stabilize neurons and reduce excessive firing. Drugs in this category include Phenytoin, Carbamazepine, Lamotrigine, topiramate, Zonisamide. These are especially useful in focal seizures and many generalized tonic-clonic seizures. Now Part 2, calcium channel modulators. Next are calcium channels. Calcium entering the neuron triggers neurotransmitter release. Different anti-seizure drugs target different calcium channel types. T-type calcium channels. These are important in absence seizures. Drugs shown here: Ethosuximide, valproic acid, topiramate, Zonisamide. Ethosuximide is the classic drug for absence seizures because it selectively blocks T-type calcium channels. High-voltage activated calcium channels. Gabapentin and pregabalin alpha-2 delta subunit of calcium channels. This reduces excitatory neurotransmitter release and decreases neuronal excitability. Part 3. SV2A modulation. Levetiracetam works differently. It binds to a synaptic vesicle protein called SV2A. This decreases neurotransmitter release from the presynaptic neuron and helps calm abnormal electrical activity. Levetiracetam is widely used because it has relatively few drug interactions and broad seizure coverage. Part 4. Glutamate receptor inhibition. Now let's look at glutamate receptors. Glutamate increases neuronal excitation mainly through NMDA receptors, AMPA receptors, NMDA receptor blockade. Felbamate blocks NMDA receptors. This reduces calcium influx and decreases excitatory signaling. Felbamate is effective but used cautiously because of serious adverse effects like aplastic anemia and liver toxicity. AMPA receptor inhibition. Topiramate also blocks AMPA receptors. This decreases sodium influx into the postsynaptic neuron and reduces excitation. That's one reason topiramate is considered a broad-spectrum anti-seizure medication. Part 5. Enhancing GABA activity. Now let's move to the inhibitory side of the brain, GABA. GABA helps calm neuronal activity by allowing chloride ions to enter neurons, making them less likely to fire. Several anti-seizure drugs enhance GABA signaling in different ways. Benzodiazepines and Phenobarbital. These drugs enhance GABA-A receptor activity. Benzodiazepines increase the frequency of chloride channel opening. Phenobarbital increases the duration of channel opening. This strengthens inhibitory signaling and rapidly suppresses seizures. These medications are especially important in status epilepticus. Tiagabine blocks the GABA transporter, GAT1. This prevents GABA reuptake, allowing more GABA to remain in the synapse. Vigabatrin inhibits GABA transaminase, also called GABA-T. This prevents GABA breakdown and increases GABA levels in the brain. It's especially used in infantile spasms. 6. Broad-spectrum drugs. One of the most important teaching points in this diagram is that some drugs act at multiple targets. Topiramate appears several times because it blocks sodium channels, blocks AMPA receptors, enhances GABA activity, affects calcium channels. That multi-target mechanism makes it a broad-spectrum anti-seizure drug. Zonisamide also has multiple mechanisms: sodium channel blockade, calcium channel modulation, enhancement of inhibitory activity. So ultimately, anti-seizure drugs work by restoring the balance between excitation and inhibition in the brain. They do this by blocking sodium channels, blocking calcium channels, reducing glutamate activity, enhancing GABA activity, or decreasing neurotransmitter release. When excitation overwhelms inhibition, seizures occur. When balance is restored, seizure activity decreases. If this breakdown helped simplify anti-seizure pharmacology, make sure to like, subscribe, and share this video with other healthcare students. Understanding mechanisms makes it much easier to remember which drug is used for which seizure type. Thanks for watching, and I'll see you in the next lesson.